Good evening and welcome to Woman. In 1935, 65% of all babies born in the United States were born at home. While home births account for only a small part of childbirths today, fewer than 5%, growing numbers of American couples are choosing home births. My guest this evening is a lay midwife who has assisted in approximately 3,500 home births. His name is Norman Casserly. Norman, welcome to the show.
Thank you very much.
Norman, is what you're doing illegal?
In some areas it's illegal, in other areas it's quite legal. In Texas, for example, the Board of Medical Examiners there supports the work of lay non-medical midwives. In other states there's quite a campaign against it, and in still other states it depends on the interpretation. Some interpretations say it is legal and some say it isn't. It depends basically on how you define the practice of medicine. If pregnancy is a disease, then handling pregnancy is the practice of medicine. If normal pregnancy is a normal physiological function, then you interpret it as being not the practice of medicine and not requiring an MD license, and in that case it's legal.
Do you have to have a license in Texas, for instance?
I am licensed and registered and certified in the state of Texas.
There are a couple of kinds of midwives, aren't there? There's the nurse midwife and the lay non-medical midwife.
Yes, a nurse midwife is a part of the medical team, and by philosophy and practice is part of the practice of medicine and surgery. Whereas a lay non-medical midwife, by definition both in the Encyclopedia Britannica and in law, does not believe in the use of medicine and surgery in most cases, and in actual law is prohibited from administering medication or practicing surgery.
Norman, tell me something about your background.
Well, I started in medical school in Dublin, Ireland, at the National University of Ireland. I spent 7 years in medical school and then came to this country and went to the University of California. And my specialty there and here was obstetrics. However, I didn't agree with the extent to which medication and surgery was being used. So I decided I would have to go out on my own and be apart from the establishment and deliver in the homes. I didn't get any practice in surgery because when cesarean cases were sent to me, I delivered them naturally.
How were you able to do that?
Well, it grew on me. I felt that by making use of the body's normal physiology, that in most cases cesarean was not necessary. Now, I do believe there are needs for cesarean, for example, in an automobile accident and in other cases, but not to the extent to which it's practiced today.
There are an awful lot of them.
Yes, in this country especially. I think in this country we practice cesarean more than in any other country in the world, although most countries are imitating us now in this field as in many other fields. In my own practice, one of the major percentage of clients who come to me is those who are scheduled for cesarean by obstetricians, and I deliver them naturally, of course.
Aren't you afraid to do that?
Oh no, after delivering 3,500 babies, and many of them scheduled for cesarean, I believe now that cesarean is avoidable in very many cases.
Why is our infant mortality rate so high?
Our infant mortality rate is about the 20th worst in the nation, and I think one of the main reasons is the excess use of drugs and surgery. For example, we have about 30 or 32 different kinds of medication, anesthesia and analgesia to use in obstetrics in this country, and it's used in about 80% of cases. Now, drugs and medication are given in proportion to body weight. A mother who weighs 120 pounds, for example, is given medication which hits a 7-pound baby, and that means the baby is getting about 20 times the shot that the mother gets. It takes about 1.5 minutes for the circulation to go around the mother's body and carry the medication with it right through the placenta into the baby. Now, the baby is the main person who conducts the birth, more so than the mother or obstetrician or midwife. And if that baby is drugged, the baby won't conduct the birth very well. The baby will come out either sluggish or with poor respiratory function or with damaged brain function. And I feel that much of the troubles that are investigated, for example, by the Martyr people, by the Cerebral Palsy Association, by the Multiple Sclerosis and the Blind Foundations. Much of those troubles are found to originate from drugs given during birth, given to excess.
There are people, though, who say that American women demand not to be in pain during childbirth.
Oh yes, well, not being in pain and not having drugs are two different things. You can have drugs and not feel the pain, or you can do it naturally and have no drugs and still have no pain. The pain is not really directly related to the drugs. Pain has a function in the body, and it's a beautiful thing. It protects the body. And you will have painful births if you do births the wrong way. And I feel the established way of doing births over the last century or so has developed to be the wrong way, and very painful and traumatic, and therefore requiring anesthesia. But if done the right way, in accordance with the body's natural function, pain can be eliminated entirely, or eliminated depending on the degree of preparation for the birth.
Norman, what are some of the reasons that couples give you for wanting to have their babies at home?
Well, most of them want a healthier baby, and a healthier mother, and a more pleasant experience, and they feel that by doing it at home, they will have that. Many of my mothers have music playing during their birth. They have it in their own atmosphere that they're used to, and have an elated, joyous event, and don't have this traumatic situation where they're tied down, strapped to a table with their legs up in the air, and stuck all over with needles and given medication. And that's a much more pleasant experience. They go about their household duties right up to the moment of birth, get up and have a shower afterwards, take the baby out for a walk, and that's a much different situation to what we're normally accustomed to.
There are many people, mostly medical professionals, who are violently opposed to this idea. What are some of the reasons that they're opposed to it?
Well, I can understand from their viewpoint to what they're used to wouldn't make it seem like that home birth would be comparable to a hospital birth. Actually, it is quite different, and I feel the advantages are on the side of home birth. Many medical men feel, for example, what would they do in the case of a hemorrhage at home? And I understand that fear. If they're going to do a home birth the way it's done in a hospital, there would be grave dangers of hemorrhages, of various complications. To do it in the home, I think you have to do it an entirely different way. You have to have a system whereby you don't depend on hospital equipment and don't depend on having hemorrhages. I have never had a mother hemorrhage in 26 years now and a few thousand births. And if I were fearful of hemorrhages, I think I shouldn't be doing home births. One of the main eliminators of hemorrhaging is breastfeeding. The breasts are connected with the uterus, and stimulation of the breast by suckling, all my mothers breastfeed, stimulation of the breast by suckling eliminates the possibility of hemorrhaging from a uterus that's left wide open and pouring blood out of it. Stimulation of the breast closes down the uterus. That's one of the reasons for eliminating hemorrhages. Another is the lack of episiotomy, which is cutting of the birth canal. That produces quite a lot of blood and hemorrhaging. And I have never done an episiotomy in my life. Some of the people who come to me are sub-teenage mothers from 11 years of age.
Norman, what about sterilization? I mean, a lot of people feel that a baby should only be born in an absolutely sterile atmosphere.
Well, sterilization is a relative thing. It's very hard to sterilize a mother and a baby. You would have to boil them both or put them in an autoclave. What really matters is nameable, identifiable bacteria that are pathogenic. Now, in a home, there are the normal bacteria that you would find in normal life. So it should be of concern in a home birth. What is there that is pathogenic? Is there tuberculosis in the home? Are there infectious diseases? In which case, I wouldn't do a home birth. But in the normal home, there are just mild bacteria that we normally live with all day long, and not pathogenic or disease-causing. I don't allow people with violent colds, for example, to attend the birth. So it's not a question of sterilizing the home and killing all bacteria in the home. For some bacteria are good and desirable. It's a question of not having infectious, contagious diseases present.
Can you describe for us exactly what happens from the time a couple calls you and says that they're interested in having their baby at home?
Yes, well, usually most couples call me before they're even pregnant. I'm booked about a year in advance. And I meet them about once a month. I stay in the home with them for about 3 days each time. And finally, I live in a week before birth and a week after birth. I start them out at the beginning, before pregnancy if possible, with theoretical courses, educational mini courses in, for example, anatomy, physiology, organic chemistry, and microbiology. That's the theory part of it. And as to the practical side, then I put them through physical exercises, check their nutrition and their diet, educate them on nutrition, put them through breathing techniques, very specific breathing techniques for birth, and also programs of massage of the uterus and the perineal area specifically. That's basically the main program.
You talk to them about attitudes. What do you say?
Attitudes are very important. It's essential to keep a mother happy. The psychosomatic aspects of birth are primary. They're very, very important. A mother who's not happy can hardly have a successful birth. The effect of the mind and attitudes on the physiology of the body, I think, are tremendous. So it's important to keep the mother happy, and for her husband to keep her happy, and it's important for her to keep herself happy. And she can do this mostly by educating herself on this subject. One of the greatest causes of unhappiness and uncertainty in pregnancy is fear. And one of the greatest causes of fear is lack of knowledge. I think most women today don't have a full knowledge of what goes on in their pregnancy and in birth. I think they should go to the public library and start reading books on either hospital or natural birth, whichever they're going to have. However, once they have covered the main textbooks on this subject, I think then they should go on further into detailed anatomy, physiology, organic chemistry, and microbiology, etc.
What do you teach them about anatomy?
All the anatomy of the whole body first. Then when we leave that, we specialize on anatomy of the uterus, the reproductive organs, both male and female, and then the anatomy of the actual taking place of the birth itself, and then the anatomy of an embryo, and of a fetus, and of a little baby. The anatomy of a baby's heart, for example, is quite different to an adult's heart, and I think it's quite important to know in birth.
What about nutrition? What do you tell them about nutrition? Basically,
I have to educate them to the way our nutrition nowadays has turned to over-chemicalized, over-preserved, over-colored foodstuffs, and it's hard to avoid that, but I think a person has to make some kind of an effort. Most of our commercial foodstuffs today all have salt in them to preserve them, but have sugar in addition to overcome the taste of the salt. Even our fruits now are gassed from the outside right into the core to preserve them, and I think this is overdone. A certain amount of preservation may be necessary in actual practice for transportation, but I think it's overdone today, and I have to educate the mothers to this fact, to try and get them onto natural foods, whether they be vegetarians or believe in some other kinds of foods. I think they have to eat naturally, they have to eat adequately, a balanced diet, and I think this is essential.
Do you tell them not to gain weight?
No. A study has recently been done in this over the last 50 years, over thousands of births, and it has been shown that our policy over the last few decades of keeping down weight has actually damaged quite a few infants. I feel they should have the weight which suits the individual, and whatever weight they have, be it a small increase or a large increase, should be a good weight. It shouldn't be all fat. It shouldn't be various edemas and swellings and toxins in their body. It should be good weight, according to what they learn themselves in physiology as they cover it.
What kind of exercise?
Well, I feel breathing exercises are vital to be able to handle the contractions that take place in the uterus. A very specific exercise that I would emphasize is an exercise to actually slow down the expulsion of the baby at the moment of birth. The baby tends to come out in 1 second, just slurp out, and I think that's far too fast. It tends to cause tears when the shoulders hit the area, then the hips hit the area, so I think it's vital that the actual expulsion be slowed down from about 1 second to maybe a minute or 5 minutes in some cases, come out very slowly. Now at that point the contractions have normally been defined as uncontrollable, involuntary. But I find by studying the subject and by breathing techniques that my mothers can control them, can stop them, can slow them, or speed them up at will by concentration on the subject and by studying it.
There are very often other people around when babies are born in the home. Friends, sometimes children, certainly the husband. How do you prepare the house for this kind of thing?
Well, I think while the mother is being prepared, put through all these things, the husband at the same time should go through the very same courses with her, and whatever children she has should go through the same courses on the same level, and whoever is going to attend the birth, the relatives and the in-laws, they should also be present during all these sessions. Now, as to the very young children, they might be present too, but nevertheless they need a special effort by introducing them to kiddies books, for example, on how a baby is born. There are a dozen or two different titles in most libraries at the present time, and they're scarcely used. But I think young children should be introduced to these baby books.
You call this method natural home birth.
Yes.
Now, is there anything different about this? Have you discovered something new?
Well, I think the whole thing is different. Basically, I haven't discovered anything new. I went to medical school too, and I start from the same principles and teachings that the basic establishment in obstetrics does. However, I put it all together differently, and my results are a little different. I have never had a death or a complication or a hemorrhage or an ambulance case or a hospital referral so far. However, that doesn't guarantee the future. I can't predict the future, but that's the way it has happened so far, and I think that is one major difference. The experience itself is quite different. There's not this traumatic pain associated with a home birth, and everybody there is elated with joy at the birth rather than watching a surgical operation take place.
How long does it usually take?
The birth itself?
Yes.
Well, a first birth might take anything from 12 hours, including the whole labor, I presume 12 hours to 36 hours is usually considered a long birth. Some births go to 48 hours. After that you become concerned about oxygenation of the baby. But as long as the vital signs are good at 48 hours, I don't like speeding up births or inducing them. I like nature to take its course, provided the vital signs are good.
You said something earlier that made me curious. You said the baby predicts how the birth will go, or the baby controls the birth, you said.
Yes.
How does a baby do that?
Well, I should say that it's desirable that the baby controls the birth. If the baby is drugged or has received drugs that the mother has received, the baby won't control the births, and the results are disastrous. And I feel that most drugged births are, to some extent, disastrous because the baby is not controlling the birth. If the mother doesn't get drugs, and the baby therefore doesn't, well, then the baby actually knows which way to turn the baby's head at various levels down through the birth canal, and then the shoulders are following at a different level. The shoulders have to turn in a different direction, then the hips have to turn around, and the baby conducts all that. Now, the baby will conduct it even better if the mother develops the baby's intelligence before birth by playing with the baby, by pushing in little parts of the baby's legs and hands from the outside of her stomach. She can even sing to the baby out loud or ring bells outside of her stomach and see if the baby responds, and they very often do. And that takes quite a neural reflex operation on the baby's part, which indicates that its neural reflexes are developing. And if some neural reflexes are developing, it's likely all of them are. So the baby will be quite intelligent before birth and be able to conduct the baby's own birth.
There's one very important thing that you have the father do during the birth. You have the father cut the cord, right?
Yes, I believe the father should do as much as possible. And if he's well educated before the birth, he can handle almost all the birth. And I'm really there as an attendant, which is the definition of a midwife, rather than a person who's God present and telling everybody what they must do by order. I'm there more or less as an advisor, or to check on complications that may be arising when they only begin, so we can catch them as a pimple. However, I don't treat complications if all my mothers are under obstetricians, preferably. If there's no obstetrician available, it's only because the mother refuses. But generally speaking, I try to get my mothers to be under qualified MDs who are obstetrical specialists. Then if a complication develops, then it's my function in law and philosophy and practice to call in the obstetrician or to refer her to an obstetrician. I do not do any administration of medication or surgery, and I do not diagnose any abnormalities or sickness or disease.
There are some things that you do differently than would happen in a hospital. For instance, you have a woman breastfeed immediately after birth, where in a hospital it could be up to 12 or 24 hours before she's urged to do that.
All my mothers breastfeed within 15 seconds at the very
15
longest.
seconds.
I'm saying to myself 1,000, 2,000, 3,000, 15 seconds at the very most. Now the stimulation of the breasts produces a closing down of the uterus, and the tens of thousands of open-ended veins and arteries and microscopic capillaries which may be pouring blood out at that time. And if they're not closed down quickly, you will have a hemorrhage. All my mothers breastfeed. I have never had a mother who hasn't breastfed. Some of them say at the beginning they would like to bottle feed because everybody else does, but when I tell them the advantages of breastfeeding, they decide for breastfeeding. So I have never experienced a hemorrhage of any of my mothers, and I think it's due mainly to the fact that they breastfeed.
You also don't bathe the baby immediately after birth.
Oh no, all babies are covered with a vernix, a mild cheesy cream at birth, and that is there for a purpose. Bathing would take that off. That's there to cover all the pores of the whole body and prevent infection from just entering through all the pores. It's there for lubrication also. It's like a cold cream, a natural face cream all over the body. And to bathe that off instantly after birth, I think just invites infections. I wouldn't dream of doing that, no.
You also invite the mother not to be lying down, but to be in other positions that are comfortable for her. This is also unusual.
I think that giving birth in the back position is the worst conceivable position possible, unless there are indications for it. Now, I use the back position occasionally if the baby's coming too fast, if it's a precipitous birth, because giving birth on the back surely slows it down. Gravity holds the baby in the back position. Most of my mothers give birth either sitting up in an armchair or sitting up on their bed with pillows all around them, or standing or squatting, because then they are vertical and gravity helps pull the baby out. They don't have to push and go through this awful traumatic situation of getting red in the face and their eyes popping out, trying to push the baby out. Now, in addition, apart from gravity, in the back position, the weight of the baby, the weight of the uterus and the amniotic fluid and the placenta are all bearing down on the spine and all the nerves controlling the birth, and bearing down on the body's main artery and vein and all the minor ones, cutting off circulation or tending to cut off circulation. So blood clots are very frequent in birth in the back position, and that's another reason why I steer clear of it. I would never use it except for a special indication to slow down a precipitous birth.
What goes on during, say, a 12-hour labor? Is the woman sitting in a chair all this time? What is she doing?
She's going about her normal life. She goes about her household chores. She's the one who prepares the meals for everybody. Not that we want to make a slave of her, but she enjoys performing her ordinary natural function, just as after the birth, in a few minutes, she gets up and has a shower. And after a few hours, she takes the baby out for a walk in the air. She does the walking, not the baby.
That seems to me incredible.
Yes.
I'm having real trouble believing that.
Well, it's happened in a few thousand of my cases so far.
You also talk about women complaining about the impersonality of childbirth these days in hospitals.
Yes, I feel that the typical hospital scene is a sort of a mass production conveyor belt system. When the woman gets on the operating table, there's somebody else waiting for her position, so she must get out of there fast. If the baby's not delivering fast enough, she must be induced. The whole staff can't wait around for another 12 or 24 hours while she's going through a slow birth. Whereas at home, it doesn't matter too much if she gives birth this evening or tomorrow morning or during the night. It just takes place when the baby's ready.
Also, I wondered about the clamping of the umbilical cord. I know in a hospital the umbilical cord would be clamped much earlier than you seem to do it at home.
Well, the standard procedure probably is, in the textbooks, in the establishment textbooks, is probably to clamp the cord within 10 to 20 minutes. I think it's not correct to go by time. It's more correct to go by the physiology of what happens. I think there's one time and one time only to clamp the cord, and that is when the blood flow stops. And there are various signs that are given for that. You can see the blood physically flowing through the cord. Now, if the cord is clamped too soon, then up to 25% of that little baby's blood can be left in the placenta, so the baby starts minus 1/4 of his blood supply, starts life anemic. If the clamping takes place too late, then the placenta may have started to deteriorate, and also the cord, and then bacteria are forming in there, and the bacteria can just physically walk their way into the baby's abdominal cavity, which must be sterile to support life. So the clamping must not be done too soon or too late, but at that one specific time.
How do you feel about parents who don't have anyone with them, who just decide to do this, who don't have a midwife around?
Oh, I don't advocate that at all, because they may be lucky. I think the chances are that they would be lucky. Luck would be on their side, but that isn't much comfort to the people who have complications. And I think one of the greatest insurances of success in a home birth is to know how to handle complications when they arise. Now, when they arise, you can't start reading a textbook or thinking what to do. It has to come automatic. And the only way to do that, I think, is through experience. You have to have somebody experienced there. I don't advocate home birth with just two people, a husband and wife, present. I don't advocate
Are there
that.
precautions, though, that you can automatically take anyway in the home?
Yes, well, I think the first precaution is self-education, the study of textbooks in the field. It's not entirely adequate. I think it's the first precaution, because textbooks in the field tell you how to do it naturally in a normal birth. There are very few textbooks, if any, written on the subject of how to handle complications naturally. There are lots of textbooks on how to handle complications in a surgical and medical way, but you don't want to do that at home. You want to handle it naturally.
Norman, do you put silver nitrate in a baby's eyes immediately after it's born, as would be done in a hospital? We have about 30 seconds.
No, I do not. Silver nitrate is obsolete in the scientific literature. It hasn't trickled down yet to actual practice, but some states have banned it and gone a few generations ahead of silver nitrate into penicillin and other things. Silver nitrate burns the eyes. It is a natural eye irritant, and I think very soon in all states it will be obsolete. No, I do not use silver nitrate.
Very quickly, do you do any of the tests, like the APGAR tests and so on, that are done in a hospital immediately after
Yes,
birth?
all of those, as long as they're non-medication tests, blood tests and everything are done by the obstetrician. I do not do those, but I do all the APGAR tests, yes.
Norman, thank you very much. It's been very pleasant chatting. Thank you for watching, and good night.